I'll talk about HIV stigma and discrimination, which is said to be the twin barriers to ending the AIDS epidemic in the country. Can you hear me well? Okay
Yes,
lang.
yes, loud and
Okay.
clear.
Okay. So as you know, despite the decades of scientific advances in prevention and treatment, as well as widespread, awareness raising efforts, irrational fears, and negative attitude towards people living with HIV, um, persistent pa din, the stigma and discrimination, which becomes a barrier in addressing the HIV epidemic. So for this session, we will be um, talking about current HIV situation, just a brief background, the national HIV strategic plan, so that we can contextualize where we're going now, and then I'll dive in right away into stigma and discrimination, its causes and effects, and then I'll touch on briefly on the stigma index study that we did last year, and then focusing on stigma and discrimination in healthcare setting, and what are the ways to eliminate stigma and discrimination. And I'll touch a bit on the RA 11166, which is anchored in human rights, and there's a lot of provisions concerning stigma and discrimination as well. So okay, so UNAIDS in 10 years ago calls for a bold action to fast track the AIDS response through human rights based approach, and aims to leave no one behind in the AIDS response. And um, and to be able to do this, we call for all countries to rapidly scale up HIV response in three main areas. One is for HIV prevention, HIV testing, HIV treatment, and these three specific strategies is now called the fast track approach. And to contextualize this, we need to reduce new infections to fewer than 500,000 by 2020, and to reduce AIDS-related death to fewer than 500,000 by 2020. And more importantly, ito yung palagi natin nakakalimutan, that to be able for us to do the first two objective, we need to eliminate HIV-related stigma and discrimination by 2020. So the country uh, the Philippines has become the fastest growing HIV in the world, with 203% in HIV infections between 2010 to 2018. And currently, it is one of the 8 countries that account for more than 85% of new infections in the region. And as of 2019, the cumulative infection was 217,000, while the current national projection is 107,000 cases. But we have gained some traction towards achieving the 1990 targets. Actually, with the current interventions in place, almost 110 new infections were averted between 2005 and 2019. And as I've said, we have gained some traction towards achieving the 1990, and as shown in the following in this slide. So in terms of the first 90, we already achieved 72% in terms of diagnosing the estimated number of PLHIV. This is based on the June 2019 report. Okay. And in terms of the second 90, we already started 62% of diagnosed PLHIV on antiretroviral treatment. Unfortunately, on the third 90, only about 17% were able to avail of the viral load. Good thing, out of the 17% na yan, about 95% are virally suppressed. So looking at the cascade, you will notice that there are some leakages along the 390 cascade. Now, the 1990 zero was initially proposed by UNAIDS, and it was adopted by the country. So you already know what the 1990 means, but I just want to emphasize the last one. It doesn't end with the 390s, but we have to focus on the fourth objective, which is zero stigma and discrimination. Now, Uh, of course, reversing the HIV epidemic remains a challenge. In 2019, there were 968,000 high-risk population from MSM, transgender women, female sex workers, and people who inject drugs. And out of this total number, it is estimated that um, and there will be 17,000 new infections along and the leakage along the HIV care cascade. If you total, the leakages between cascade, uh, it could be 51,000 PLHIV not on ART, and this number of PLHIVs could potentially infect other individuals. And this is the reason why we have an increasing projection in terms of new infections. So by 2020 alone, there will be 17,000 new infections on top of the 90,400 in 2019. So meaning the longer it takes for us to expand
Ano
our
'yan, kaya nga.
hello, the longer we expand our treatment coverage, the higher number of people we need to provide treatment. Now, just a brief, uh, uh, you know, slide on where are these cases. 80%, 82% of diagnosed cases were coming from priority areas: National Capital Region 4A, 3, and Cebu Province, and the other cities. Okay. Um, and based on AIDS epidemiologic model, new infections will increase by 21,000 by the end of 2022 if we remain our 2018 baseline coverage. So if you look at the graph, so increasing pa rin yung trend natin, considering our baseline 2018 baseline coverage. So by the end of 2030, new infection will increase to 46,000. So this is, I think, too much. So if we really need to act now, or else ayaw natin maabot yung 46,000 by the end of 2030. Now, in terms of the estimated PLHIV, it will increase to 143,000. Right now, it's 90,400. Okay. And by the end of the 2019, for 2020, it is estimated to be 109,570. So comparing, the 2020 and the 2030, I mean, 10 years, there will be 247 increase, uh, and that means 235 growth rate. So now, this slide will show us the green one is the baseline with the current prevention package that we have, okay, including the ART coverage of around 60. Now, the red one, the middle one, is the national projection if we increase ART coverage based on the historical trend, okay? What we want is to achieve the blue one, that we need to reverse new infections by the end of 2022. It has to be less than 7,000 new infections. So, and we can only do that with this revised national HIV strategic plan. It's not published yet. We're still finalizing it. We're assisting the national program, but these are now the objectives, of the national HIV program. Again, the vision is zero new infections, zero discrimination, and zero AIDS-related death. And the goal is by the end of 2022, there will be less than 7,000 new infections. So going to the main topic, so stigma, just a definition. HIV stigma is negative attitudes and beliefs about people living with HIV, and it is a prejudice that comes with labeling an individual as part of a group that is believed to be socially unacceptable. There are a few examples, like believing that only certain groups of people can get HIV. Okay, particularly MSM, transgender women, and sex workers, and making moral judgment about people who take steps to prevent HIV transmission, like, we say, pag gumagamit ng condom, malandi, or maraming sex partner, those judgments. feeling that people deserve to get HIV because of their choices. Kanina, I think it was asked, in the poll survey that we blame the PLHIV for being promiscuous or having a multiple sexual partners. And also, PLHIVs are negatively judged and blamed for their illness. We know that people living with HIV experience stigmatization primarily because of the fear that HIV is highly contagious disease and that casual contact with an infected person could result to others contracting the disease as well. So, what causes HIV stigma? So, HIV stigma is rooted in a fear of HIV since 20 decades ago, but until now, this fear still happens. So, parang 2020, 2020 na te, but still, may mga tao pa rin natatakot because of HIV. And there are still misconceptions about how HIV is transmitted and what it means to live with HIV today. I think the lack of information and awareness combined with outdated beliefs lead people to fear getting HIV. And that's the reason why when we talk about, ways of eliminating stigma, I think we have to go back to the basic in terms of providing more information. Okay. And many people think of HIV as a disease that only certain groups of people get, like the MSM or transgender women. Now, for discrimination, it is defined as discrimination having a behavior that result from those attitudes of belief. It's now, acting on the stigma. This is where discrimination happens when you act on your beliefs. Okay, and HIV discrimination, particularly for people living HIV with HIV differently than those without HIV. Like for example, using of double globe, like na magdo-double globe ka for pale HIV and not for those who are not PLHIV, that's a form of discrimination. Okay, so few examples: health professional refusing to provide care to serve or services to people living with HIV, refusing casual contact with someone living with HIV, socially isolating a member of the community because they are HIV positive, or referring to people as positive. We'll talk about how powerful words can be in a later slide. So I think we really need to make ourselves, uh, lo- you know, uh, aware of the right choice of words if we talk about HIV and pill HIV. Now, what are the effects? So HIV stigma discrimination affect the emotional well-being and mental health of people living with HIV. People living with HIV often internalize the stigma and they experience and begin to develop a negative self image. So, this is where internalized stigma or self stigma happens. And it happens when a person takes in the negative ideas and stereotypes about people living with HIV and start to apply them to themselves. And internalized stigma can lead to feelings of shame, uh, fear of disclosure, isolation, and despair. This is the reason why, until now, konti pa lang yung tao na nagdi-disclose in public, or even to their families. And these feelings can keep people from getting tested and treated for HIV. So, HIV stigma and discrimination affect the emotional well-being and mental health of people living with HIV. And people living with HIV often internalize this stigma. Okay. Now, just to give you a conceptual framework, how HIV related stigmatization and HIV related discrimination can lead to internal stigma, external stigma, and then loss of its socioeconomic opportunities, unfair treatment in institutional settings, which combining all of this can lead to concealment of status due to shame and fear, lack of motivation for diagnosis and treatment, lack of community and institutional support. and increased number of HIV related stigma and discrimination cases and further spread of diseases in the country. So when I mentioned that, the stigma and discrimination still fuels the epidemic in this country, this is the evidence why we really need to act on the issue of stigma and discrimination. Okay, just to show you that there is a study conducted in 2019. This is the title of that study, The Philippine People Living with HIV Stigma Index. So if you want I think I already sent the full report. If you're interested, I can give it to Kate and then she can share it to you. So the need to address this stigma is also being recognized as it is viewed as the silent killer that fuels the spread of the HIV epidemic, not just in the Philippines, but across other country affected nations. And the need to intensify HIV prevention campaigns through public information and education drives and sex education schools, and the need to establish grievance mechanisms for cases of discrimination are also being proposed. So, and this is why we're pushing hard for the Department of Education to institutionalize comprehensive sexuality education because the lack of awareness, the ignorance about the disease fuels the stigma and discrimination. So just as as some results of that study, if you look at uh, you know uh, the stigma experienced by PLHIV across all the variables, meron pa din, no? And that's why uh, we can still say that um, stigma and discriminations among PLHIV are still persistent. Now, this table, when the respondents were asked about their encounters, well, healthcare providers, so this is us, for HIV specific health concern, 15% of respondents said they were advised not to have sex because of their HIV status. Hello, di ba? Parang bakit nasasabihin hindi sila na pwede makipag-sex? It's a biologic need. So, and you're discriminating them of enjoying their sexual life. So, and 15% of them were advised by their health providers not to have sex. Okay. Now, the next slide, another variables. This is a percentage of respondents reporting stigma and discrimination when accessing non-HIV related care naman. So, um, 36% actually said they have sought healthcare from non-HIV related needs such as malaria, flu, dental, vaccination, and other diseases. And among them, 11.5% experienced being talked badly or gossiped about, while 8.2% were denied of health services. So, marami pa rin chismosa sa ating mga health providers. And I think this is the reason why tumataas yung ating default rate. And right now, in terms of the lost follow-up, it's already 17%. And this is a missed opportunity because we already started them on treatment. But because of the way we treat them in the facility, they decided not to go back for the field or follow-up consultations. The most common form of discrimination they experience is that of having family members making discriminatory remarks about them because of their being transgender. 27% of them. And this is human rights and effecting change. Um, and we know that the family, while it remains steadfast in its role as safety nets for HIV, um, in this study, it has been cited as the most common venue for discrimination. The family na dapat ay a safe space, pero sila pa din yung nagdi-discriminate ng kanilang family member. So, Just to give you a brief background about the Republic Act 11166, which aims to provide better healthcare services to people living with HIV, their families, and at-risk population. The we the Philippines, celebrates this because this is a historic, a landmark of legislation for the country. This in 2018, and the IRR was already signed in July 12, 2019, and it has a comprehensive provision on primary prevention, and the country, and gives the country the latitude to pursue evidence-based interventions, including condom and supposed to be even NSP or needle syringe program because it's evidence based. Okay, this law also guarantees access to HIV treatment, including management of OIs. Dapat libre na din yan. So on top of the ARVs, it provides for care and support program for PLHIV, and it also integrates HIV services in the country's universal healthcare coverage. So this is an exciting times for us with the passage of this law and the universal healthcare. Maraming opportunity na i-marry yung dalawa, and then um, even the PrEP or testing and other preventive strategies can now be part of the universal healthcare coverage. No. So what are the salient points of the new age law? One, the age of consent for HIV testing now lowered to 15 years old. Interventions are expanded to far-flung, hard-to-reach in communities of indigenous people. Inclusion of the workplace policy on HIV and AIDS in both public and private establishments, considering the demographics of our new cases coming from young people, 15 to 24. Most of them are young professionals in workplaces, but they cannot access HIV services. So we want to strengthen, yung functionality of HIV in the workplaces. Provision of comprehensive healthcare services to PLHIVs and their families, intensifying health education on HIV, AIDS, and human rights principles to reduce stigma and discrimination. Okay? Kasi nga, based on the two stigma index survey that we had, mataas pa rin ang yung stigma and discrimination. Non-discrimination of PLHIV by health insurers and health maintenance organizations. So just an update, Insurance Commission issued a circular which there are a lot of provisions we think are not in accordance with the Republic Act. So Kate and I were going to the dialogue meeting with the Insurance Commission next week. Okay. Stricter rules on patient confidentiality and harsher punishments for nonconformity, and strengthening technologies in medical interventions for HIV/AIDS, including PrEP now. And uh, soon, probably June or July, we will now have a newer drug recommended by WHO, dolutegravir. So it's in combination with tenofovir and lamivudine, which is, I think, is much, much safer than the LTE that we have right now. So, just a quick rundown on specific provisions in the law na related to stigma and discrimination. Like this one, it says that the state shall ensure delivery of non-discriminatory HIV/AIDS services by the government and private HIV and AIDS service providers. So, nasa batas. Another one, to ensure access to HIV and AIDS related services by eliminating the climate of stigma and discrimination that surrounds the country's HIV and AIDS situation. Positively address and seek eradicate conditions that aggravate the spread of HIV infection, which include poverty, gender inequality, marginalization, and ignorance. So, yung ignorance kailangan putulin na natin. Okay? Now, there are specific provisions. The whole section of Section 10 talks about protection of human rights. So, sinasabi na the country's response to HIV and AIDS situation shall be anchored on principles of human rights and human dignity. And when we talk about human rights and human dignity, dito pumapasok yung issue ng stigma and discrimination. Okay? The members of PNAC, in cooperation with CSOs and collaboration of the UJ and Commission of Human Rights, shall ensure delivery of non-discriminatory HIV and AIDS services by government. Okay, and also inuutusan ng DOJ and CHR in coordination with the PNAC and other government agencies to take the lead in developing redress mechanism for failed HIV. For the past decades, ang hirap-hirap ng isang PhilHIV na discriminate to bring this issue, in a in a proper venue. Okay? And that's also the reason why wala tayong malinaw na datos kung ilan talaga yung naka-experience ng discrimination because walang venue kung saan dadalhin. But now, we're happy na sa bagong batas, sinabi na kailangan makadevelop tayo ng redress mechanism na kailangan na pwedeng puntahan ng PhilHIV na nakaranas ng discrimination. Section 40 talks about the non-discriminatory HIV and AIDS services. So, madami yan. So, also, Rule 9, the whole chapter of Section 40 describes discriminatory, sorry, this one. The whole section of Section 49 talks about discriminatory acts and practices. Discrimination in the workplace, learning institutions, travel and habitation. Dito rin nakalagay yung concerning burial services. Okay? Now, zeroing in on stigma and discrimination in healthcare settings. That's what I believe na tayo naman mga health workers really want to help and do the right thing. And sometimes we're not aware that something we are doing helpful is actually stigmatizing. And stigma is often about perception. You have to remember that. It is not about how the provider sees things. It's how the clients interprets your words, your actions. So it's about perception. So the health workers might not see themselves as having stigmatizing tendencies, while the clients may feel that they are being stigmatized. So, and the first step to reducing stigma and discrimination in healthcare facilities is ensuring that staff members are educated about what stigma is, can identify stigmatizing behaviors, and understand the true consequences of stigma and discrimination. Now, these are just example of stigma and discrimination in healthcare setting. A pharmacist who had organized a separate medication pickup line for people living with HIV. Maganda yung intention para mas mabilis sana sinegregate niya yung refill ng mga PLHIV sa non-PLHIV. But this is a form of discrimination, magandang intention, but you're parang giving way, na ma-identify itong mga PLHIV natin. Parang nadi-disclose sila even if they don't want to. Okay? Fear of transmission might lead some healthcare workers to wear 2 pairs of gloves when treating patients living with HIV. We just need to observe the universal precaution. Wala namang silbi yung dalawang gloves. It's supposed to be the same with all patients. Okay? Staff members might decide to only wear gloves when working with patients who are living with HIV rather than wearing gloves with all patients. Like for example, kung nagtitipid tayo in a resource limited setting, yung gloves ay nire-reserve na lang natin if we handle PLHIV patients. So this should not be the case because again, this can be misinterpreted. Kahit maganda yung intention, this can be misinterpreted as discrimination. Okay? Professionals working to reduce stigma often prefer the term client or patient, as the latter in itself can be perceived as negative. So we don't call them patients anymore, okay? They prefer the term client kasi mas positive rather than patient. So how do we eliminate? The first step, as I said, in reducing stigma in healthcare is by ensuring that all staff members are educated about what stigma and discrimination is. And tama yung ginagawa ni Kate. We conduct surveys in healthcare settings to help identify the key actionable drivers and gaps in care, followed by participatory training. Like, for example, if the cause of stigma is because of the lack of information about SOGI, kaya nadi-discriminate yung ating mga transgender women, then we need to provide them, training on SOGI. Okay? And for example, nagdo-double globing sila because they fear na may infect sila. I think we need to retrain them about universal precaution. So those things, okay? For these training sessions to be effective, they must be include all the staff members, including the guards, cleaning staff, receptionists, as well doctors and nurses. So para din yung buong hospital or buong treatment or buong facility are aware of what to do, okay, to address stigma. And more importantly, they also need to involve active participation of people living with HIV because, as I mentioned, this is a perception. Kung hindi natin involve yung mga PHIV, hindi natin malalaman kung ano yung iniisip nila towards us health providers. Now, the words we use matter, okay? Learn how to talk openly about HIV and stigma in a way that can help empower those living with HIV. And language shapes beliefs and may influence behaviors. And the, this are just examples of, ano ba yung mga terms na dapat gamitin natin. So, yung AIDS, when referring to viruses, HIV is a problematic word or phrase. Dapat ang preferred natin dyan, HIV. So, HIV and AIDS when we are both referring. So, hindi na tayo dapat HIV tas slash AIDS because those are two different things, right? So, also the use of, you will catch AIDS or to catch it, pass on HIV. We don't use that phrase anymore. I think the proper way is, diagnosing HIV, acquiring HIV, or transmitting HIV. So I can share you this tawag dito, document para lang alam natin kung ano yung mga terms na dapat na natin gamitin for HIV and PHIV. We avoid using victims, sufferers, contaminated because it gives a negative connotation. Remember this, sabi nga natin, the first word in HIV is human. So, and PLH, kaya tinawag natin na people living with HIV because they are person first. There are people first uh, before they get HIV. So, we need to remember that. So, what are the effects? Uh, One, if you invest on stigma reduction, you'll have a payoff along the whole treatment cascade from testing, linking to care, and starting treatment and adherence. Okay, so it cuts across the three 90s, and that's why importante yung fourth na objective ng ating 1990 zero goal. So it has a compounding effect which translates to an investment in HIV testing, treatment, and to overall patient health. And we need to break down access barriers to HIV. It breaks down, access barrier to HIV services. Meaning, if the providers are more aware of how they should clients, so mas maiengganyo yung mga kliyente natin na mag-access ng services. But learning to overcome HIV stigma is not always an easy thing. It requires degree of self-reflection as well an honest assessment of your own personal biases and beliefs. So, kasi meron tayong mga beliefs, mahirap yan matanggal. But we have to be cognizant of the principles of stigma and discrimination para din maiwasan natin. So, in summary, I just like to say that despite advances in prevention, treatment of HIV, still the shadow of stigma is still prevalent and affecting many of those living with the disease. And elimination of stigma and discrimination is a prerequisite. We cannot halt the epidemic if we do not address stigma and discrimination. Healthcare providers play a significant role in achieving zero discrimination as a vision of health sector. Hindi, and we're an integral part of the whole system, para ma-address natin ma-achieve natin yung zero stigma and discrimination. And we need to fully implement the law kasi napakaganda na ng batas na to. It's all there. We just need to operationalize and localize this, down to the local government units because this has a strong anchor for stigma reduction program. I think that's my last slide. So sabi nga ni Elizabeth Taylor, it is bad enough that people are dying of AIDS, but no one should die of ignorance anymore. With that, thank you for listening.